The Irish Pain Society, this is our 11th annual scientific meeting today. It's very much a multidisciplinary society. Today we have physiotherapists, psychologists, pain medicine clinicians and nurses today. In fact, one of our speakers earlier on even commented on the fact that it's very much a multidisciplinary. Our talks this morning were all multidisciplinary, so it's very appealing that way. It's a very important society. We're a small group in Ireland. Today we have 100 delegates who have turned up, which is probably nearly everybody working in pain in Ireland is represented here today, and I think that's fantastic. Yet, here I am saying we're a small group in Ireland, and yet every patient who attends hospital suffers from pain. Studies done in Europe in the last 10 years have shown that 1 in every 13 people have chronic pain, so 1 in every family in Ireland has chronic pain. And meetings like today are so important for us to spread the word, to spread the knowledge, so that we can improve the pathway for our patients, either in the acute or the chronic setting. And in theory, if we improve the management of pain, we should reduce the incident of chronic pain in time.
That's great. There was something about the outcomes about the island being higher or lower on the opiate scale.
I think Ireland was sort of mid on that scale that was shown earlier on. And I think what the speaker was trying to say was that we have opiates available and that we don't use them maybe to the best of what we could use them. In many ways that's knowledge, that's misbeliefs, that's myths that influence that. But opiates are not the only way of treating pain. And I wouldn't like anybody to come away thinking that, oh, well, if we gave more opiates, we would get rid of pain. It's not going to be like that. It's multidisciplinary. It's an element of pain management. We're in there more or less with the rest of Europe from the opiate point of view, but we do need to do more in our education. If you ask the nurses or the med students, young doctors outside, how much education they got in pain management, they won't be able to tell you that they got a definitive amount of time in their training in pain medicine. Because I work in Beaumont Hospital, I teach the interns, the med students and the nurses there. And often I might be the first point of contact in a formal pain education. That's too late. It needs to be from the beginning of their education, and what we're hoping to do and drive with the Irish Pain Society is bring people from when they are students into the Pain Society.
Great.
We have a big drive on this year to get members to join us in the Pain Society.